All right. I'm going to give us about another minute to allow people to join, and then I'll start our introductions here in a moment. Okay, looks like we're at that 12 o'clock mark, so I'll go ahead and get us started. So good afternoon and welcome to the National Child Abuse Prevention webinar hosted by Mary Bridge Children's and Kids Mental Health Pierce County. I'm Jasmine Gregory and I am the Professional Development Specialist for Social Workers at Mary Bridge Children's. Today we have the pleasure of hearing from Lindsay Finney, the manager for the Pierce County Child Advocacy Center and Child Abuse Intervention Department. Lindsay has a background in victim services, child welfare, and medical social work. And as the manager of the Children's Advocacy Center, she leads a multidisciplinary team of professionals working towards the prevention and treatment of child abuse victims and their families. We welcome you to go ahead and put in the chat your name, role, and agency you are joining from. Please feel free to ask any questions throughout the training. I'll be managing the Q&A in the chat so that I can share those questions with Lindsay throughout. And you can utilize the Q&A function to do so. Please note that there is no continuing education credits for this webinar. I am able to provide a certificate of completion upon request though. All right, I'll go ahead and stop sharing and hand it over to you, Lindsay.
Hello, and thank you. Let me share my screen. All right, so good afternoon, good morning. I guess it's noon. So thank you, Jasmine, for the introduction. My name's Lindsay Finney, as she stated, and I am the manager of the Children's Advocacy Center of Pierce County. So today I'm going to be talking to you about a few different things. So feel free to drop questions in the chat as we go along. I see some familiar faces on the attendee list. Hi. So we'll start out by talking about what the Children's Advocacy Center model is. We'll talk about how to talk to kids about abuse, how to talk to kids after disclosure, minimal facts safety interviews that can take place, and we'll end with some prevention tips. So when we say that we work for a Children's Advocacy Center, a lot of people are like, what is that? And so really, the CAC is a multidisciplinary team of professionals that are working in the prevention, treatment, and prosecution of child abuse victims. The first CAC was founded in the 1980s in Huntsville, Alabama. Robert Bud Kramer, he was a former district attorney and congressman in the area. And as his work, in his work as a prosecutor, he found that child abuse cases just were not having good, successful prosecution outcomes. He found that a lot of work was being duplicated. There was many people involved in these investigations. Kids were being interviewed multiple times. And as a result, kids and families were dropping out of the prosecution process. So he really had a vision for a more coordinated approach to these types of cases. And he wanted to bring systems that were not used to working together together to collaborate and serve child abuse victims. CACs, they are founded on the belief that child abuse is a community problem. There's no single agency designed to meet the needs of child abuse victims and their families on their own. And so by collaborating and sharing information with one another, systems can work together to effectively treat child abuse victims. This is a picture of our CAC. We're located on the Mary Bridge Hospital campus. We are the only hospital-based CAC in the state of Washington. CACs are designed to be child-centered, neutral, and safe environments for kids to come to with their non-offending caregivers to receive services. And so really, it's where various disciplines of professionals collaborate in providing these services while the allegations of abuse are investigated. One of the primary goals of having a CAC in place is to reduce the number of times a child was interviewed, and we'll talk more about that in a minute. And really, the ultimate goal of CACs is to lead to more successful outcomes for these kids. There's over 900 CACs located throughout the country and abroad. They're going to look different wherever you are. They're designed to meet the needs of their community. And so some are prosecution based, some are law enforcement based, many are nonprofits. It really just depends on the needs of that community and what that county decided to do in terms of serving child abuse victims. So before we're going to be primarily talking about sexual abuse today. CACs were originally designed to address the concerns of sexual abuse. They've evolved greatly over the years to now address concerns of physical abuse, sexual exploitation, child sexual abuse material, really any and all types of physical abuse or all types of abuse can be addressed with the CAC model. But sexual abuse makes up the majority of the kids that we see. So one thing I like to point out just about sexual abuse, if you're working with kids or you've worked with kids who've experienced this, it's helpful to understand that there are many, many barriers to disclosure. There are many, many reasons that kids don't tell when and if sexual abuse is happening. There's a lot of shame and embarrassment with sexual abuse. There's fear of not being believed or getting in trouble. Um, and there's a lot of reasons that kids might not disclose while something is happening and may disclose years or months or years later. Um, there's also risk factors for recantation, which is essentially if a child makes a disclosure and then at a later time says, no, that didn't happen. Oftentimes in those situations, it's important to look at, are there external factors that may be impacting that child? And in many cases, when a child recants, there may be an unsupportive or unbelieving caregiver. There may be continued contact with that alleged offender per a parenting plan or family court requirements, or that person still resides in their home. So these are just things to kind of keep in the back of your mind as we talk about child sexual abuse. So why do we need a coordinated response to child abuse? Again, coordination is really the gist of the CAC model. Before CACs, like I mentioned, kids were interviewed multiple times. And I mentioned also that they were originally designed to address child sexual abuse. Sexual abuse is much more prevalent than many people realize. Annually, 400,000 kids experience sexual abuse in the United States. That information comes from the National Children's Alliance, which is our accrediting body. And conservatively, 1 in 4 girls and 1 in 13 boys will experience sexual abuse in their lifetime. That comes from the CDC. I want to preface those numbers with those are the kids that we know about. So if you think about the barriers to disclosure, the reasons kids don't tell, the true number of child abuse victims likely will never be known. Depending on what agency or what website you're doing your research through, you may see different numbers. I've seen websites that reference 1 in 6 boys, 1 in 9 boys. So really what these numbers are telling us is child sexual abuse is very prevalent, and we work with the numbers that we have, that we of the victims that we know about. 90% of victims know their abuser when it comes to child sexual abuse. So kids are abused by people that they know, that they love, that they trust. And that is part of the grooming and manipulation process that happens. Many people never tell or finally disclose when they're an adult, so delayed disclosures are extremely common. We often interview kids where something happened 5 years ago, sometimes longer. And partial disclosures are common as well. So a lot of times, if a child decides that they're going to disclose sexual abuse to an adult, depending on the type of reaction that they get, they may or may not continue with that disclosure. So if they get a supportive reaction, you know, and that caregiver believes them, they will likely continue with that disclosure. If they get kind of a dismissive reaction or that caregiver is not supportive, they're unlikely to continue that disclosure and they may not disclose again. And then it's important to remember that false reports are rare. It's important that kids are believed and their disclosures are taken seriously when they happen. This is a helpful graphic to explain what a child may experience with a CAC and without. So if you look at the red diagram, the child's in the middle. Say for a minute that you are a 7-year-old and you just disclosed you're being sexually abused to your school counselor. So your school counselor is asking you questions about your disclosure. Per their policy, that counselor has to notify their principal. So the principal is coming in and also asking you questions. They decide together that they need to call law enforcement. So patrol responds to your school and they're asking you questions about what you told your counselor and your principal. At some point, they're like, this needs to be assigned to a detective. So that detective is called in. It's reported to Child Protective Services. Those are 2 more individuals that are interviewing you. Maybe you have medical needs in relation to what happened, and so you're transported to a medical clinic, and those medical staff and personnel, they're asking you the same questions. And so you can see how many opportunities there are to question kids about the abuse they experienced, and how, in that questioning, what they're saying may appear different to people. That doesn't mean they're lying. That doesn't mean they're not being truthful. It just means when you interview a child over and over and over about the same thing, they may describe it differently. They may provide more or less detail, based on the types of questions that they are asked. So the blue diagram shows you what kids experience with the CAC. So they are coming to the center. They are the center of that appointment. There's going to be law enforcement present, Child Protective Services. There's medical providers on staff where they can have a medical evaluation or, ask questions about their body. There's victim advocacy and social work support. So really everyone is coming together to collaborate for that child to ensure that they have the best opportunity to talk about what happened to them and receive, ongoing support and services. So what services occur at the CAC? I'm speaking specifically about the CAC of Pierce County. So again, centers look different depending on what county you're in. So they may or may not have all of the services that we provide. And that's just based on the need or funding, lots of different reasons. At our center, we provide forensic interviews, both emergent and non-emergent. We provide medical evaluations, acute and non-acute. We have social workers. We have victim advocates from Rebuilding Hope. We have therapy. We facilitate a caregiver support group for parents who have a child who has experienced sexual abuse twice a year. And we do 2 community trainings, sexual abuse prevention and internet safety. We do those at different places throughout the county. I'll drop a flyer in the chat before this is over. We're doing an internet safety at Tacoma Police Department next week. We'll be on JBLM the end of April, and we just go various places. So talking about forensic interviews, what is a forensic interview? It's a formal investigative interview, and the primary purpose is to gather reliable information from an unbiased, in an unbiased and objective way. So interviews are audio and video recorded. Investigators observe from another room. And it's just one of the many pieces of evidence and information that's collected during these investigations. They're conducted by trained child forensic interviewers who go through many trainings on how to talk to kids and how to ask questions in these situations. And they provide these interviews in a sensitive way to the child's age development and emotional capacity. In Pierce County, we interview kids ages 3 to 15 when there's been a disclosure of sexual abuse or felony level physical abuse, when the abuse has been witnessed or recorded, when there's been a confession by a suspect, or if the child has witnessed a violent crime. Typically, those are kids witnessing homicides or felony assault situations. Another thing to note about forensic interviews is It does not replace the need for the child to testify in court. There are various hearsay laws in Washington state that define when a forensic interview can be played in court, and whether, and that determines whether the child needs to testify or not. So, the ultimate goal is to bring the child, have them speak to a trained interviewer to talk about what happened to them one time at that time, to gather the most information that is needed. So medical evaluations, this is a picture of our exam room, and the one thing about medical evaluations is they confirm that abuse occurred in less than 5% of cases. I think there's a common misconception that if a child has a medical exam, we'll be able to tell, our providers will be able to tell, like, if there's been an assault or if there was some type of penetration, and that's just not the case. And there's lots of reasons for that. Delayed disclosures are common. Kids are abused by people they know, that they love, that they trust. And many types of touching leaves no signs. Also, that our genital area on our body is very similar to the inside of our mouth. And so if you think of, like, if you bite your cheek and you might have an injury there for a few days, after that injury heals, there's no sign that you had maybe a sore on the side of your inside of your cheek. Complete healing can and does occur. Our medical professionals testify in court all the time why a medical exam, why a normal exam is normal. The primary purpose of us doing medical exams is to reassure kids that their bodies are healthy and safe. A lot of kids have distorted views of their bodies in relation to the abuse that happened, and really having an evaluation is an opportunity for them to ask questions, receive clarifications, maybe, ask questions they're not comfortable asking other people. If you look here at the end of the exam room, that is our colposcope. And what that is it essentially acts like a very large magnifying glass. So our providers can zoom in on areas of the body. So our exams are non-invasive, and that magnifying glass allows them to zoom in on genitalia, bruises, different types of injuries if they are present. So what do you do if you learn a child has been abused? The first thing and most important thing is believe and support them. We have so many kids come to our center, and the reason that they say they didn't tell anyone is because they didn't think that anyone would believe them, or they were worried about getting in trouble. And so supporting them and telling them that they believe, or that you believe them, is very important. Staying calm as much as you can. Obviously, these are upsetting situations and there's lots of emotions involved, but kids are also worried about how you're going to react. Another reason kids often tell us why they didn't tell anyone is they're worried about how their parent's going to react. They knew their parent was going to be upset and they don't want to make them upset. Reassure them that it's not their fault and they're not in trouble. Keep them informed about what will happen next as much as possible, and that might just be as simple as saying, I'm a mandatory reporter and we have to report this. And don't make promises you can't keep. Examples of that could be, I'm going to make sure that person goes to jail, or you're never going to have to see them again. There are a lot of situations where offenders don't go to jail, and there's a lot of situations where kids have to keep seeing that alleged offender because maybe they're a parent and there is a parenting plan in place and they have to keep going for visitation. And so trying not to make those types of promises is helpful. And then reporting the abuse to law enforcement and CPS. One of the things I train a lot of community partners on is, if you're reporting that a child is being sexually abused, while the RCW says you can call either, it's best to call both. And I'll talk more about that in a minute, but making sure that both law enforcement and CPS are notified. And then here's our information. We have a website, we have a phone number. We field cold calls all the time from community professionals, from parents, anyone. So if you're working with the family who may be experiencing some type of abuse, or the parent just wants resources, feel free to refer them to us and we're happy to speak with them. So this should all be familiar to all of you. This is the RCW for mandatory reporting, and I put this in here just because I like to point out that it says law enforcement or the department. Reporting to both, there's lots of reasons why that's best for the child. First of all, it ensures a timely response and in coordination of services. Secondly, sexual abuse and assault is a crime, and it needs to have a legal investigation. CPS investigates individuals who act in local parentis, and so people that are acting as a caregiver to that child. So I mentioned before that 90% of kids are abused by people they know, but if it's uncle or grandpa or a neighbor, CPS might not investigate that. And so if you're only reporting to CPS, while there are metrics in place to allow for information sharing between agencies, there could be a delay in that, or maybe the jurisdiction might be wrong. There's just lots of reasons to help ensure seamless services in cases of sexual abuse and assault to report to both law enforcement and CPS. So I'm not sure if any of you are familiar with problematic sexual behaviors. In Washington State, kids under the age of 12 cannot be prosecuted. We deal with this a lot, where there's kids offending on other kids and they're both under the age of 12. It's still important to report these concerns because patterns of concerning behavior need to be documented, or there may be safety concerns in the home that could be addressed, through another agency. And it allows the victim to still receive services, but it also allows the offending child to receive some type of intervention or services as well. These are really difficult cases and situations. They impact many people. And this website here, it's the National Center for Sexual Behavior of Youth. It's a really helpful website. It has resources for providers and also for caregivers, just talking about if you have a child or you're working with a child who's displaying problematic sexual behaviors, these are things you can do, conversations you can have, etc. But everyone in these situations needs treatment and intervention. It's very important for intervention for these kids so that behavior can be addressed. Because if it continues and they're 12, then they will be investigated. So how do you talk to kids after disclosure? If you're receiving a disclosure from a child, letting go of the habit of asking who, what, when, where, why, the very specific questions to try and get more information about the crime. Asking questions related to the crime itself in these situations does not give you information about that child's safety at that time, and that can interfere with the legal investigation. So asking more open-ended prompts about child safety can allow you, to assess that a little bit more. It's important to transition knowing that there is a Pierce County protocol. There is a process for, if a child has disclosed that sexual abuse has occurred, that they will have that forensic interview. And being able to explain that in a way that they understand. So what you told me is very important. There will be some other people who want to speak with you about that. Or what you told me is very important. I'm not going to ask you about that more right now, but someone I work with will ask you about that at a later time. One of the things we train our DCYF and law enforcement partners on is minimal facts safety interviewing. So again, this is allowing you to ask questions about the child's safety and is not asking specific questions about the crime itself. So if you're curious about offender access, where does that person live, or when will you see them again? That can give you an idea, like that person's going to be at home after school. They're going home to that person, or they haven't seen that person in a couple of years. That's information that you can include in your report, or if you're having to call, if there's an immediate safety concern and you're having to call. As far as caregiver protectiveness, questions regarding that is, who else have you told about this? Oh, well, I told my mom. What did she say after you told her? Well, she told me that didn't happen and I didn't know what I was talking about. Or she told me something that, a statement that she was believing the child and supportive. And so These are specific, just open-ended questions that can be asked to help glean information about child safety in these situations. So as far as prevention, like I said, one of our primary community trainings that we do is sexual abuse prevention education. It's a 2-hour training, and it really goes into depth about offender behavior, how to recognize offender behavior, and then what do we do about preventing it, preventing child sexual abuse. So I don't go too much into prevention today, but that is a training we offer regularly, and we're happy to come to your agency or notify you of upcoming trainings if you're interested. One of the things we focus on for prevention is historically a lot of sexual abuse prevention curriculums focused on teaching kids to keep themselves safe. And we really want to empower adults to keep kids safe. We tell kids from a very young age that they can't say no to us and they have to listen to us. And just relying on them to protect themselves is just not effective. One of the number one things for prevention is to teach the correct names for all body parts. Kids should know the name penis and vagina. We say that a lot in our clinic, probably more so than some other people, but it takes away the shame and embarrassment, in talking about body safety and in having these conversations. We want to normalize having these conversations with kids so they know about it. Assure kids that they can tell you if something happens. If an example, if anyone touches or looks at your private parts or tries to get you to touch or look at theirs, tell me or another person you trust. And then this one's important. Give kids a list of people they can tell. So a lot of kids don't tell their parent or primary caregiver for many reasons. Like I mentioned before, they're worried about upsetting you. They're worried about if it will affect the family. And so a lot of parents are really devastated when they come in and they just don't understand why their child didn't tell them. But be happy they told someone. And as hard as it is, don't take it personally if they don't tell you. The fact that they told is a huge success. And so giving them a list of 5 people or a list of 3 people they could tell. Maybe it's a neighbor, maybe it's another relative or someone at school. So they know that there's other trusted adults in their circle. And then if you remember, kids are worried they're not going to be believed. So again, assure them they will be believed. I won't be mad at you. You won't be in trouble. And secrets versus surprises. There's no reason an adult should have a secret with a child. If a child is telling you they have a secret with an adult, that should be a red flag. Surprises is a more appropriate term. So maybe grandma's birthday is next week and we're going to have a surprise birthday party. So we're not going to tell anyone right now, but next Tuesday, everyone's going to find out about it and grandma will know. And so differentiating between the two. And then again, normalizing the conversation. So talk to kids about abuse and offender behavior. Include sexual abuse talks in any other regular safety talks. So kids know to put their seatbelt on when they get in a car. They know to wear a helmet when they ride a bike, and they know to wear a life jacket when they're on the water. So if you have these conversations regularly, it normalizes that conversation. And it lets kids know that it's okay to tell. If kids grow up thinking that they can't talk about sexual abuse or even body safety, they're not going to be comfortable in disclosing if something's happening. And by normalizing the conversations, it also empowers adults to report something. If something is disclosed, they'll know what to do if a child discloses to them. The Hot Chocolate Talks, that's a great resource if you're interested in talking with your own kids or providing this resources to adults that you work with. This is really just basic conversation starters that adults can have with kids about body safety. It's broken up by age, so 0 to 5. An example, can you point to the parts on your body covered by underwear? They're covered because they are private. So again, a lot of people are uncomfortable having these types of conversations, but these have some good conversation starters to start talking to your kids about body safety. They have one for 6 to 8 years, 9 to 10, and then 11 plus. The 11 plus one, it talks more about online and taking photographs, things like that. So their website's right there, and that is a resource we hand out to every caregiver that comes to our clinic, regardless of whether they are coming here for concerns of sexual abuse, if they're coming for physical abuse, or any other reason, they're still going to get this handout, so they know how to have that conversation. And I realized I went really fast. So these are some resources. Obviously, our website is here, 1in6.org. That is talking about male victims of sexual abuse. They have some really good videos that I'd encourage you to watch. Rebuilding Hope is a sexual assault center for Pierce and Kitsap County. The hot chocolate talks that I mentioned. Dr. Toni Kavanaugh Johnson, she really has some great resources about problematic sexual behaviors. She has a book about what's developmentally appropriate and what's not developmentally appropriate, and then what do you do about it? So if you have problematic sexual behaviors, how do you address it? And then there's that website I mentioned earlier of the National Center of Sexual Behavior of Youth. But are there any questions or comments at all?
Thank you so much, Lindsay. I didn't see any questions in the Q&A or in the chat, but if people have the ability to come off mute or want to ask a question, maybe a situation that you've experienced that you were unsure about. Okay, I have a question from Jane. Are mandated reporters required to report in the private lives as well as professional lives?
I'm not a legal professional, but the answer I would say is yes. If you're a mandatory reporter and you come across an allegation of abuse, it should be reported.
Jane says thank you, and she agrees. And then there was a question about getting a copy of the PowerPoints. I will send that out with a follow-up email with the survey as well.
I'll send you the flyer, our internet safety flyer that's coming up to attach with that, Jasmine, because I can't put it in the chat for some reason. But
okay, yeah, no problem. Any other questions or scenarios that people have or wanted to talk about?
sorry, I talked fast.
No problem. Do you serve the whole state or counties outside of Pierce?
It depends. We primarily serve Pierce County for medical patients because we're a part of a children's hospital that's also a pediatric trauma center. We do see some kids outside of Pierce County. So I think there's about 5 counties in Washington State that don't have a CAC. Not all of them have medical professionals. It's actually a huge crisis we're facing right now is a lack of medical providers across the state that are specialized in treating child abuse victims. And so we do have kids that may travel from Kitsap County or, South King County, but primarily we serve Pierce County.
You've got a few comments of appreciation for mentioning the visual aspects, as not everything is touching in this digital world. The resource around the hot chocolate talks.
Yeah, I would say if you're able to come to our internet safety training, please do. Child sexual abuse and exploitation is changing because of the internet. And so there's just a lot we can learn as adults in the terms of prevention. Kids will always know more about technology than we will because they've had it from such a young age. So yeah, we definitely it's important to talk about digital as well. The training, Jasmine will include that in the follow-up email. It's in person. It's at the Tacoma Police Department on Tuesday from 1 to 3. Are there facilities or places where kids who are engaging in problematic sexual behaviors can help or get treatment? There's a huge lack of resources for treatment for kids with problematic sexual behaviors. If the child is involved in the juvenile justice system because there's a legal investigation, oftentimes there's treatment available. There's a very limited amount of mental health providers that provide therapy for that type of issue. And so really a lot of it is focused on safety planning. A lot of these situations include siblings or people, kids that live in the same home. And so there's just a lot of education that can be provided with caregivers about how do you keep your kids safe in your home, and also start having these conversations about this is not appropriate and what do we do about it. Would the training ever be online? So a little bit about our training. We worked with an individual named Corey Jewel Jensen to bring this training to Pierce County. She's a former sex offender treatment provider from the state of Oregon. And part of the training is viewing videos from offenders. And so we can't put it online because they're sensitive in nature. And the reason we show those videos, because they did videos as part of their treatment. But what we say, at the beginning of our prevention training is we rely on child safety experts for a variety of child safety concerns, right? Like we listen to the experts about bike helmets and water safety. And so while we don't condone offender behavior, it's important to learn how they perpetrated abuse so we can help better prevent it. And so at this point, that was a long-winded answer of we don't have it online right now. Yeah, we do offer the trainings fairly regularly. And so, Kids Mental Health Pierce County is great about sending those out. We try and have them like once a month or every 2 months. Are there established guidelines, interventions for schools or guardians for kids who are engaging in sexually inappropriate behaviors? I would refer you to the National Center on Sexual Behavior of Youth, because again, they have resources for providers and they also have resources for caregivers. And so there are documents and things on there that would be good for you to look at.
And Lindsay, can you repeat the name of that website, and I'll get the link and put it in the chat.
Yeah, it's the last, can you see my screen? It's the last bullet.
Perfect.
National Center, on Sexual Behavior of Youth. Say the organization again. National Center on the Sexual Behavior of Youth. And yes, the lack of therapists and treatment for youth who are engaging in these behaviors is extremely challenging. And it's kind of a crisis, just because these kids, those kids need intervention and treatment as well. And intervention is so important.
Wonderful. Any final questions or comments? Will this training be available? This training that Lindsay just did is recorded, and it will be shared on the Kids Mental Health Pierce County website by the end of this week, if not early next week. Yep. Okay, I'm going to switch over slides really quickly just to go over some final thoughts. So I posted the survey link in the chat, and here is a QR code. Please complete this before you close out today, just to make sure we get any feedback to better support the trainings and webinars we've been putting on this year. And And then we've already gone over questions. And then here's some contact information for Kids Mental Health Pierce County, Kids Mental Health Washington, and myself with Mary Bridge Children's for different webinar content you might be interested or looking forward to. We welcome any recommendations from you all here as well. Thank you again, Lindsay. Like I said, this training is recorded. We'll post it to Kids Mental Health Pierce County. No certificates for continuing education, but I can give you a certificate of completion for those that request it. Thank you for your time. Have a great rest of your day.